Hi, my name is Asia. I'm the student nurse. Today I will be performing a head-to-toe assessment. Please let me know if you have any discomfort.
No, I have no pain.
Okay. I'm looking at her overall appearance, her mood, her alertness, her skin color. It's all within normal limits. I'm going to start by, I would assess her vital signs, which would include blood pressure, pulse, respirations, temperature, and the oxygen saturation. Are you in any pain today?
No pain.
Okay. So I will start by assessing her head and scalp, checking for shape, lesions, or any type of abnormalities. So this is what I'm doing. Okay. So I don't feel any abnormalities. I then will do cranial nerve 5. So I'm gonna put my hands on your face and you let me know when you feel the touch, okay?
Yeah.
Okay, can you clench your jaw? I'm assessing the masseter and the temporal muscles. Okay, then I'm gonna check cranial nerve 7. Can you please smile, frown, and puff out your cheeks? Okay, thank you. I will then go to your ears. Your eyes. Okay, so when inspecting your eyes, can you put one hand over your eye? Let me know when you can see my finger.
This is my right eye. I can see your finger.
Okay, so using only your eyes, this is cranial nerve 2. Using only your eyes, I want you to follow my finger, okay?
Okay.
Okay, very good. Let's test the other eye. Let me know when you can see my finger.
I'm covering my left eye.
Okay. All right, so now I'm gonna test your pupils. Just look straight for me. Okay, your pupils are equal, round, reactive to light and accommodation. All right, the next I'm gonna go on and I'm going to actually check your eye. It's a 2-in-1 ophthalmoscope and an otoscope, okay?
Okay.
Get them in the camera, get out of it. Sorry.
Do it again. And you go this way or forward, but you have to show.
Okay. Okay. Mm-mm. Okay. I'm gonna check I'm looking at your eyelids. You close your eyes, open your eyelids. I'm checking your eyelashes. And then I would wash my hands, don gloves. I would also check or pull down your eyelids. I'm checking your lacrimal duct, your conjunctiva, and your sclera, which there's no yellowness, there's no redness, and it's all within normal limits. Okay. 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 Then I'm gonna go on to your ears. Let's see. Okay. So I'm checking for the position of your ears. They're symmetric. I'm checking the pinna. I don't see any breakdown, or I don't feel any lumps or anything. I'm gonna check your ear canal.
I'm looking at
Okay. Is this her right side? Okay. So I've had curly gray. Okay, I'm also going to do 3 tests, which is the Rhyme, the Weber, and the Whisper test. Okay? So I'm gonna say something and I want you to tell me what you hear. Okay? 1, 2.
1, 2. Red, green.
Yes. I'm also gonna perform the Rhyme test. So I just want you to tell me when you stop hearing it, and then I'm gonna move it to another place, and then you again tell me when you stop hearing it.
Okay.
Okay. So,
I don't hear it. Stop.
okay. So right side will do the same thing. I'll start here. You let me know when you stop hearing it, and then.
Stop. Stop.
I'm also gonna perform the Weber test, which I'm gonna place this on top of your head, and you let me know if you hear it both sides or more on one side or the other.
Okay.
Let me know.
More on the right side.
More on the right side.
Again.
You wanna do it again?
Both.
Both.
Mhm.
Okay, good. Okay. So far we went over cranial nerve 1, which cranial nerve 1 actually here it actually smells. What does it smell like?
Lemon.
Okay, good. So cranial nerve 1, which is smells, cranial nerve 2, which was my finger, cranial nerve 3, 4, and 6, which is following my finger and perla. Okay, and then we are moving on. Oh, I also did cranial nerve 5 and 7, which I said in the beginning. And then, yeah, 7 was smell. Okay, so now we're gonna move on to your nose. So I'm looking at the general appearance of your nose. It is symmetric, it's midline. I'm gonna touch your nose. I'm feeling the bridge of your nose and the soft tissues. Any tenderness?
No.
Okay, I'm also gonna check your senses. Any tenderness? Sinuses?
No tenderness.
No tenderness? Any tenderness?
No.
Okay. Oh, not the cranial nerve 8. Okay. For your nose, so I'm also going to look at your nose. I'm gonna check your nasal cavity. Don't worry about it. Oh, I'm sorry. Okay. My bad, let's do it. Okay. Your septum is good. I don't see any deviation. Let me put these to the side. See any deviations. And your sinuses, everything is good. We did sense of smell, right? So then we're gonna move on to your mouth and throat. I'm gonna inspect your mouth. Again, I will perform hand hygiene, put my gloves on. So with this one, I'm going to check your teeth, gums, and tonsils. I'm gonna check your soft palate and your hard palate. Okay. And I'm gonna have you stick out your tongue, wiggle it around, and we'll test your gag reflex.
Okay.
Okay.
Yeah, pause it.
Okay. Okay, so now I'm gonna do the mouth and throat. So I'm gonna inspect your teeth, your gums, and your tonsils. I'm also gonna check your cheeks, your soft and hard palate. We're also gonna do your gag reflex and test cranial nerve 12. Okay.
Okay.
All right. So open up. Okay. Stick your tongue out. Stick it up. Soft palate. All right. I'm gonna put my. Okay. 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 So now, everything was within normal limits. Her tonsils were pink. Her cheeks were pink, moist. Tongue moist, pink. I didn't smell an odor. Her teeth are great. Gums are great. Okay. So now we're gonna move on to your neck. All right. So I'm gonna start off by feeling her lymph nodes. Okay. So it's okay. Let me touch it. All right. So. Can you shrug your shoulders? Any tenderness anywhere?
No.
Okay. Try to turn your head towards my hand. Try to turn your head to my hand. Okay, very good. Okay, so I'm gonna need you to just lay back a little bit. I need you to do it for. Actually, stay up for a second. Put your head up this way. I'm sorry. I'm sorry. I need to check the tracheal in its midline, your carotid, your carotid arteries here. That's good. I'm gonna go this side. This is her right side. Notch in the vein. Okay, it's good. It's two within normal limits. Okay, so I'm looking at her. This is her thyroid. Like I said, the trachea is fine, it's not deviated. I'm also going to Can you take a deep breath and exhale and hold it? Okay, good. Do the same on this side. Okay, good. I don't hear any swishing sounds. I don't hear any breeze. Okay, I'm also gonna listen to your okay, so I'm assessing the skin. We're doing posterior chest. I'm assessing the skin, which I don't see any lesions. I don't see anything, skin breakdown at all. I don't see any nodules or acne. So I'm going to check for lung expansion. Okay, so sorry. So I'm gonna ask you to take a deep breath. For me. Can you take a deep breath for me? Okay. More. Okay, very good. I'm also going to do tactile firmitus. So basically, when I put my hands on your back, say every time you feel it, say 99. Okay.
99, 99, 99, 99, 99.
Okay. Okay. So I'm also so I'm also gonna listen to your lungs back here. Start at the top here. And bring me down, yes. Can you take a deep breath for me? Actually, take a deep breath. 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 Okay, very good. I'm also going to do some percussion. Okay?
Okay.
Alright, so see. I hope they can see me all the time. Okay. So now we'll turn around. And we'll do the anterior chest. Okay, so I'm also gonna do the same thing where I'm gonna check for lung expansion. Okay. Deep breath. Okay, very good. Alright, so she has full lung expansion. Again, her skin looks good. No breakdown, no lesions, no lumps. I don't see anything. I'm also going to do tactile firmitus again. And then you say, when I place my hands, you say 99. Okay?
99, 99, 99, 99, 99.
Okay. I'm also going to listen to your lungs here. And start at the apex of the lungs. Take a deep breath. Okay, good. Okay, good. Her lungs sound clear. So now we're going to do the assessment of the heart. Okay, respirations were 18. Now I'm going to just listen to her heart, do the heart assessment. I'm going to start at the aortic. I'm going to come to second intercostal space. Pulmonic. Herbs Point. Tricuspid. Mitral, which is where I would listen for the apical pulse for 60 seconds. All within normal limits. And you can turn around and listen to how it sounds. Sorry. Okay, good. All normal within normal limits. Okay, you can turn around. Before you sit down, I'm gonna check your pulses. Alright, so I'm gonna do the brachial pulse, the radial pulse. Which is good. Let me just check your motion here. I'm checking her Poppy's pulse. Okay, and then I'm gonna check her pedal pulse. You can try to put the pedal pulse, which is here on top. Here. And then the pulse that's right here, the dorsalis. Okay. Alright, after checking the dorsal tibialis, all pulses are noted to be strong, palpable, +2. I'm gonna go and I'm gonna check the arteries. We'll start with the aortic artery, the bell of the stethoscope. I'm gonna come up and a little over to the left. And I'm gonna go to the renal artery, the iliac artery, the femoral artery, Okay, all those are within normal limits. I'll now have her sit down and we'll do the JED assessment. Okay, you turn your head side. Okay, so I'm gonna face this way. Should be able to. I'm gonna check for GVD. Alright, hold your, take a deep breath, hold it. Okay, let's check the other side. a deep breath in, hold it. Exhale. Okay, good. I don't hear any swishing or brewing. Okay. Okay, now we're moving on to the abdomen. I inspected the skin. I don't see any lesions. I don't see any open areas. It doesn't look to be distended. I will now auscultate the bowel sounds. Okay, I'm going to start in the right lower quadrant. Okay, so I hear active bowel sounds. Okay, so sorry, I'm gonna mute you. Okay, so now I'm gonna percuss all the quadrants. Is that okay?
Mm-hmm.
Okay. Okay, do you have any? Okay, so now after I percussed all the quadrants, I'm going to do a light palpation. Okay. Do you have any tenderness? If you do, just let me know. Okay.
Okay.
Okay, so now I'm going to do a deep.
No pain.
No pain.
No
No
tenderness.
tenderness. Okay. So no rebound tenderness noted. All right. Last thing was, when was your last bowel movement?
Today.
Okay. All right. So we're gonna move on to the upper extremities. I'm gonna start by inspecting her clavicles, scapula, shoulders, and then we'll get into range of motion for her joints. So I'm just inspecting this. Let me know if you feel any tenderness, any pain, anything.
No tenderness. No pain.
Scapula, shoulders. Can you lift your arms? Can you bend your elbows? I don't hear or feel any clicking. Okay. Again, I don't hear, feel any clicking. I see a wrist. No. Okay, no clicking or sounds in that one, but on the left side was a little bit. Okay. All right. Fingers. I don't see any nodules. Do you have any pain
No.
or anything like that? Capillary refill comes back in less than a couple seconds. Let's see this one. Okay. And same thing with the hand. Can you take my fingers and squeeze them as hard as you can? Okay, very good. All right, can you put your arms up like this? Can you try to push back? Very good. Can you try to squeeze in? Can you try to go out? Very good. Okay. Then we're gonna move on to your. All right, so we'll check your reflexes,
No pain.
and then no pain. Then I'll check your knees. Okay, any pain?
No
Okay.
pain.
Normal reflexes. Okay, and then all reflexes, upper extremities within normal limits. So if you could stand up for a second, we'll check your hips. We'll check your hips. Can you lift your leg? Can you lift it out? Any pain?
No.
I don't hear any clicking or anything like that. Okay. Now we're gonna move on to your lower extremities. So I'm gonna inspect and palpate your lower extremities. So you have pins on, but it's okay. Have you noticed any swelling?
No.
No. Okay. Any openings, anything on your legs?
No.
No. Okay. So then I also need to, if you want to just have a seat, I need to inspect your ankles and feet. Okay, we're checking your foot. All right, so I'm looking at her foot. She does seem to have a little bit of swelling here, but she did note that she rolled her ankle. So then I'm just looking, check her capillary refill. It's good, it's returning. Okay, so just try to push your foot back up. Try to push your foot down. Okay, good. Can you try? I know it might be painful. Can you roll it? Can you do it the other way? Okay, very good. Normal findings in the feet, ankles, and legs. Full range of motion. No pain reported. All right, so if you could stand up, we'll do your spine. Okay, so I'm looking at her posture. She seems okay. She seems aligned. If you could actually turn like this way and bend over, I'll check your spinal column. So I don't see anything, no protrusions, nothing coming up. Her spine is good. Okay, you can sit back. You can stand back up. Sorry about that. Okay, so palpate it. The muscles, everything looks good. No openings. Everything is within. Okay, now we're gonna go into RAM. She's gonna do the heel, the shin test. Okay. All right, and then we're gonna do the exteroceptive sensation. I have this, and you close your eyes and tell me, is it hot or is it cold? Cold, cold. Okay, so now we're gonna move on to the proprioception portion where I'm gonna take your hand and show you the movements, and then you're gonna close your eyes. I'm gonna do your feet, and then you tell me the movement. Okay, is it okay? Okay. So this is up, this is down, this is in, and this is out. Okay? Okay. Okay, so give me your foot. So just tell me where your foot is, okay?
Up, in, out, down.
Okay, very good. All right, so then now we're gonna move on to sternosis. So I'm gonna put something in your hand. You're gonna close your eyes and you're gonna tell me what it is. Okay?
Okay.
Okay. Put your hand out. Okay. Tell me what this is.
Pen.
Okay, very good. All right, so now we're gonna go on to graphesthesia. I'm gonna trace something in your hand and then you tell me what it is, okay?
Okay. Not sure. Honestly, friend, what are you doing?
I was doing A. I'll do something else.
Yeah, like you can't do something that you have to lift your finger because I can't tell what you're
Oh,
doing.
I'm sorry. Okay, sorry. Okay, so.
Do you want to start it over?
Nope. Okay, ready?
V?
Yes. I'm sorry. All right, so now we're going to do this 2-point discrimination. So I'm going to either put 1 down or 2. You tell me what it is. Okay?
1. 1. 1.
Okay. Alrighty, so if you could stand up, excuse me, sorry. Alright. So I just want you, if you could walk. Okay. Alright, and then so you're standing, you're walking. Can you walk on your heels? Good. Can you walk on your tiptoes? Okay. Can you do heel to toe? Okay, very good. All right. So now, if you can put your arms out, we're gonna do the Romberg's test. So close your eyes and just stand still with your arms out. I don't see any swing. If you could flip your hands over, we're gonna do the pronator drift. And again, she's within normal limits, no swing. Okay, do you feel dizzy or anything?
No.
Okay. All right.
Dizziness.
No dizziness. Okay, awesome.